Hello again. I am answering questions about chronic pain, and we are up to number 8. Number 8. Can you describe what your body feels like? Yes, I can try. Let's go from my head down. My head, I do have migraines, so sometimes that interferes even more with the chronic pain. I am now having pain in my neck, radiating down to my arms. That's a newer pain. I'm not sure if it's actually the cervical spine. What cervical spine is basically your neck and the upper back, really up high. That's the cervical spine. I'm thinking maybe something's going on there now at this point, but I can't deal with that right now. Because some days it's really bad, and some days it's like today I'm not feeling it so much, but yesterday it really hurt. Put a heating pad on and hope for the best. Can't deal with that right now. Most of my pain is my lower back, especially on the left side, going down on both sides, because I not only have it on, I always had it on the right side, and now I have it on the left side also. On the right side, it's down the butt and around to the front of my right thigh. That's the worst pain, the right thigh. And excuse me, on the left side, down the butt and to the back of the left thigh. So it's most of my pain is from my waist to my knees. That is the most pain. Then of course I have pain in my knees, arthritis pain. I had surgery on my one knee, so I need a new knee on the left side. And then of course down your feet, your ankles. My feet are a lot of times swollen. So how do I describe how my body feels? I kind of feel excuse me. You know how you feel when you haven't exercised in years, and then all of a sudden you decide, I'm going to exercise, and you go and you like exercise like a lunatic for like 2 hours, and you really go out of your way, and you know how you feel the next few days? That's how I feel all the time. It goes from an ache to sharp pains, to throbbing, to electrical shocks, muscle aches. I mean, it's just about any kind of pain you could think of. And it's truly, I mean, it goes into my hands, there's not a part of my body, maybe my ears, that's about it. There's not a part of my body that does not hurt. So that's how my body feels. It hurts all the time. Number 9, what have you learned about yourself as an individual that deals with chronic pain on a daily basis? What have I learned about myself? Well, I think I've learned that I'm very, very strong, because if I wasn't strong and if I didn't have a good attitude about this, I think I would have gone insane. I think I definitely would have had a nervous breakdown by now. Because if I really stop and think about what I've gone through and how I've been all this time, I would just stop and be hysterical. And I must say that every once in a while it does get to me, and I do shed some tears, but on the most part I just keep going forward, because there's really not much else you can do. But I think I am pretty strong, and I think it's probably even made me stronger. It's made me realize how some things in life are so small and don't really matter. So I guess that's about it. And the last question, what is your next step in the fight against your chronic pain? That would be the spinal cord stimulator trial. And that's what I really wanted to make these videos about, because I wanted to document how I'm feeling before I have it done. Because sometimes after you have something done, or you've taken medication, or you've had an injection, you don't remember how much pain you were in. So I wanted to make this to say, this is how I'm feeling. I'm in excruciating pain. My back hurts. My legs hurt. I can't do much. And now, next week, I'll be going for a spinal cord stimulator trial. And just quickly to say what that is. You go into the pain management doctor's office, as I've gone many a time to have my injections. They put you under, I'm not sure if they actually put you under sedation, or they kind of keep you awake so they can ask you how the pain is. They put in a needle into your back, into your lower back, that has like a hole. They thread two wires, I think they're about that long, that have these, like, I'm assuming they're like little tiny transmitters. They put, here's your vertebrae with your spinal cord in the middle. They put one up on one side and one up on the other side in the epidural space. Attached to these two wires are leads. The leads, now for the trial, this is not going, that went inside my body, but the rest of it will be outside of my body. So there will be wires coming out of my back attached to the mechanism and attached to a battery pack, which will be wrapped around my waist. And you have a remote control. And you use a stimulation pattern, different patterns. And it's kind of like if you've ever gone to physical therapy and you've had those pads put on you, and they put on, and you go zit, 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 and zit, 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 all those kind of things, except it's inside of you. And the trial, you go through the trial to see if it works. They said it'll probably be inside of me like this, with the wires outside of me, for approximately 5 days to see how it works. The whole idea behind the spinal cord stimulator, it's basically, it's not fixing any problem. It's not getting rid of your pain. It's basically tricking your brain, and instead of feeling pain, you feel the stimulation, which could be like a little zit, 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 like little stimulation, instead of feeling pain. So you still have the pain, you still have all your problems, but you just don't feel it. And if you don't feel the pain, you could then go on about, you know, your day. Hopefully. That's the hope. That it masks the pain. So your brain doesn't feel it. If your brain doesn't, you know, if the signals that are coming up your back saying you're in pain, you're in pain, you're in pain, come up and go zit, 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 instead of saying I'm in pain, then you don't feel the pain. If your brain doesn't feel the pain, you don't feel the pain. That's the hope. They consider if your pain is reduced by 50% or more, that it is successful. If it is successful, the trial is successful, and you've cut down your pain by 50%, you can cut down your pain medication by hopefully 50%. You will still be on pain medication, but hopefully you won't need to take it as much. And if it works, you go back, they take it out, and you decide with your doctor it worked. If it works, then you go back to your surgeon, and you go for surgery, and you have it permanently implanted. So the leads would go up your back, the wires would be inside you, almost like this little thing that's like a kind of like a pacemaker would be implanted into your top of your hip. They make like a 3-inch incision, put it in, sew you up, and it's permanently implanted. And you get the remote control, and you get this thing that you put on it to charge the battery. I think you charge the battery once a week. just like you would recharge your cell phone or anything like that. The remote control will have different programs on it, different patterns. They may have to, while they do the trial, they may have to do adjustments, make it go up higher, down lower, wherever your pain is. And it's made by Boston Scientific, and I will be going on June 30th, 2017. So hopefully it will work and I can get back to a normal, well, relatively normal life. Thanks for listening.